The Board of Trustees of Crystal City Independent School District will meet in special session at 5:30 PM Wednesday, August 19th, 2026, in the Administration Building, Boardroom 613B. Item 1, call to meet. Time is, miss? Roll call, please.
Mr. Vince Martinez.
Here.
Mr. Simon Houston.
Here.
Mr. Cruz Mata, absent. Mr. Victor Bonilla III, absent. Mr. Gabriel Espinosa, absent. Mr. Ray Espinosa.
Here.
And Mrs. Peggy Young.
Here.
We do have quorum. A moment of reflection. Thank you. Any public comments? No public comments? No public comments, right? Item 5, action items. A discussion and action to adopt a health insurance contract. So we had already done that, right, sir? Right? We had already adopted the contract? We're just need to adopt the plans?
I believe so. There was a plans that we were going to adopt today.
How many plans do we have?
It's the 2 medical plans
But under the company?
with 1921.
Okay.
Yes.
We have,
Zach, yeah, you can go ahead and present the,
they enlarge the,
do you have the larger ones?
No, I didn't finish it.
Okay.
yeah.
Mr. Mata should be here.
Yeah, he'll be here in a little bit. It should be like in 10 minutes.
Thank you, Hetty.
Yes. And I'll leave you all with some of these as well. Y'all want to let anybody want it? I'll take it. Thank you. Good deal. Well, I appreciate y'all, members of the board, having me out again. I know it's been a kind of a wild scenario with the broker of record transition. Do appreciate you guys trusting us and voting us in. Going to give a little bit of an analysis of kind of us doing our due diligence and where over the past week or so been working with Mr. Grill and the team here to try to provide y'all with the best options in the marketplace. Obviously, the circumstances are tough. We addressed that. I wanted to kind of walk you through what we looked at. So we were awarded finally the broker of record on August the 11th. Given the transition, it had been rescinded. We weren't able to get access to data, whatnot. Got it August 11th. We're able to get, God bless my team, we're able to get all the proposals and everything done by August 13th, present that, and now we're presenting in front of you guys. We shopped over 37 different carriers. 10 of those provided us with numbers, 5 declined to quote. Blue Cross Blue Shield had delivered a renewal of 30% back in July 15th. We were not able to beat them to the punch as far as getting that renewal and trying to negotiate it. So we were given that on the 11th. Biggest thing to note when we were looking at this is, given the reduced contribution, in order to be ACA compliant, we had to have a plan that was cheaper than our benchmark of the TRS plan. It's around $480. We had to get it to where a plan was roughly $380. And today we're able to do that. That is with Tress Health, a $2,500 plan, $2,500 deductible. Now, I did, in talking with Mr. Grill and the team, we needed to get a baseline plan in place so we can meet that affordability. It is going to be some disruption for the staff with that base plan. Had to be in compliance, minimum value, minimum coverage. Now, we also are offering what is called curative. Okay, the city, Crystal City actually utilizes this plan. Quite a few school districts, very competent school districts. We use it at our office and share my family with it.
That's what,
Say again?
that's what,
Curative. So it's a nationwide health insurance plan. key notes with Curative and why it's so popular, why we use it at our office, why many folks are using it today, especially in South Texas. You jump on a baseline visit, all right, and we'll walk them through this at open enrollment. Go ahead.
If you're gonna cover it,
Okay, yeah, so health insurance plan. So we got that base plan to make sure we're within compliance, and then we have this plan that I feel like is going to be the most cost effective for the staff out of pocket when it comes to co-pays, actually seeking care, out of pocket max surgeries, et cetera. Yes, sir.
Juan, can you share the packets that they have for us, or that they have in our packet?
I don't have it in two forms are like this,
Okay,
and they're real small, the copies we have, so.
okay, all right, thank you.
We'll post it on the website.
Okay.
Good. So looking at this plan here, we've got these two plans to look at. This page 2 really just shows kind of the timeline of events. No need to spend a ton of time there, but wanted to walk y'all, show you all that. Page number 3. Okay, this shows it shows the Blue Cross renewal, right, at a 33% increase for some of those plans. Employee only's costing on our lowest cost plan, costing roughly $1,000 for the employee only. So we had to essentially cut a plan by 75% to meet that ACA affordability. We were able to do that. Here we show all the rates, and what I want you to look at is the plan design. So we're seeing $5,000 deductibles, $750, $1,500 deductibles, $5,000 deductibles. For us, in providing a benefit to the district, and why you'll see what our recommendation is to go with Curative, is because the way the plan design is structured. If you jump on a baseline visit, which is a 15-minute call outlining how the plan works, outlining the plan structure, locating your nearest primary care physician, which in this area, y'all's major hospital in Creasville Springs, there's little to no disruption. So we did run an overlay of the networks, and they cover 90-something% of the step where people are going today, which is great. But if they do that, do the baseline visit, 20 to 35-minute phone call, deductible, copay, out-of-pocket max, and tier 1, tier 2 prescriptions are $0 for the staff, right? So they're going to have to pay more in premium, but as far as staff that needs to seek medical care, it's going to be $0 for them, right? So as opposed to paying a $5,000, $10,000 deductible, out-of-pocket max of $18,000, that's going to be $0 for the staff. So, right, we're going to have that bottom plan that's going to have preventative care. It is not going to be very rich, right? There are some things that it will not cover, and I outlined some of those in here, right? Some specific cancer care, cancer treatment, radiology, but primary care, getting your specialty copays, seeing a specialist, that base plan with Trust Health will cover those. But for that more bolstered plan at $0, man, it's a really rich plan. I think that given the status of where we're at today, offering the two to meet compliance and then also provide a really strong benefit, I think is our best option. Based off of TRS and the out-of-pocket costs with that, it saves the individual around $2,000. So on an annual basis. So had to get very creative. And I do want to note for you guys to know, this is we were trying to put in install a 1-year solution, right? Our goal is to invest and be in the boat to where we can build a long-term sustainable health plan. We know given the circumstances this year, we need a 1-year solution. So I want to work with the team, new superintendent to build towards that. That is a lot of the remainder of these slides that are on here is really just kind of outlining the plan structures, why we had to go with the $2,500 plan. There was not a carrier out there that we could get outside of Trust Health to be ACA and the affordability.
Zach, do you have one of these for Mr. Walker?
Here.
Sorry.
No worries.
appreciate it, thank you.
Biggest thing to reiterate is the Trust Health is going to be a step down, right? You can imagine you cut health insurance by 75%. It's not going to be the rich bolstered plan that maybe we have today. Preventative care is free and unlimited. Telemedicine is free and unlimited. Routine office visits is $25 copay for primary care, $50 for specialties. Generic drugs are $10. Labs and imaging. We do have programs where they can get those done at $0. I'll show that in the back of the booklet. They'll also have access to a care navigator with Tress Health where they can call in, hey, I'm having trouble with this. How do I navigate this process, seeking care for the PCP, a surgery, and they'll help them to navigate that. This Tress Health plan does have, out of transparency, does have limits. So you're limited to 8 primary care visits a year, 8 specialty visits, 5 inpatient hospital stays, 1 outpatient surgery, 1 ER visit, 2 urgent care visits, and 1 ground ambulance trip. It only covers preventative and tier 1 drugs, chemotherapy, radiation therapy, dialysis, transplants, and infusion therapies are not covered. And so it is a preventative care plan that they have that meets ACA affordability. They need all of those things covered. They can buy it and it's covered at $0.
And after, like, say for the 8th visit, what happens? They just have to fork out
They have to pay out of pocket. Yep. So, the last page 8, you'll see some of the network disruption analysis. We did it based off zip code. So you can see how many PCPs, pediatrician, OB-GYNs, specialists, hospitals, urgent cares, pharmacies that are still within the network in comparison to Blue Cross. We're looking at a curatives network, and this is only within a 20-mile radius, right? So we want to make sure it's close so folks have care. It is important to note that Tress Health also utilizes the PHCS network. That may mean nothing to you guys, but that is a nationwide network. It is a different style plan as well for the major surgeries. They do what's called reference-based pricing to where they negotiate a lower rate of Medicare, so it lowers the claim, just as some nuance with Tress Health. That's a lot. I didn't want to take up too much of y'all's time, but wanted to leave some time for question. As far as our plan for the future, we're going to be meeting starting in January, relatively soon after the open enrollment, to get with the team to start planning for next year, so we can try to get ahead of the curve, monitoring claims, looking at some solutions to try to stay ahead of it. I would put on y'all's radar and talking with the team and Mr. Brill to look at in the future building towards increasing the contributions. I'm sure that's no secret. But that's our path, making sure we address pharmacy. That was a majority of our claims, addressing Medicare eligible staff, helping them to concierge them through that. Big initiative at open enrollment this year is we're going to have to educate the staff on these plans, how they work, what it is and what it isn't. So there's not a lack of understanding what they're enrolling in. So we're going to drive that home. And then making sure that we try to develop a good relationship with the local providers. There's 2 hospitals that are really close here. Want to make sure that we can build some sort of a contract or relationship with there for the future. So that's everything from a high level. The last few slides or the last few pages really are talking about Tress Health. They offer a MD Live for mental health needs, anxiety, depression, grief, weight loss at a $0 copay. There's that Tress Health Care Navigator to help folks make sure that they're seeing providers in their locations to understand who's in their network, who's not in their network. And then for medical imaging benefits, this is $0 cost options for them to get medical imaging if they go to select providers. So
For the staff, I mean, plan, because the main concern from staff members or which plan to choose, so
right.
what, I mean,
Yeah.
best for them, as far as, I mean, how much they have to pay.
Right. I think that's
Eventually, the family and or the whole family.
that's going to be something that we're going to want to sit down when we talk one-on-one with each staff member. Say, hey, look, what are your needs? What are we looking to do? Right? Are you a young, gym teacher that maybe sees the doctor once a year? Okay, hey, look, it doesn't make sense for you to get this bolstered plan. Hey, I got a family and I think we're going to need some significant medical needs throughout the year. Hey, let's look at, this plan and outline what the costs may be given your needs. And so that's something that we will consult with them at open enrollment to make sure they understand that. And throughout the year, right, when there's new hires, helping them to educate them on the plans. We're going to want to educate the staff as well, so that way they can answer some questions, but we're going to want them to call our office with new hires and open enrollment so we can help them and consult them.
As far as open enrollment, I mean, if approved today, when would y'all look at enrolling everybody? Would it be the whole month of September or?
It's really up to the team here. We had planned, we thought we were gonna have to go live with everything 9/1, so we were gonna be out here Friday. But I think we have a little bit more time, gonna want to get with them to make sure it fits into their schedule, however they want to do it. Typically, we've done it in the past where either we do an all day where we sit in an office and have staff come in as they can. If we need to do it a week, a couple days, we'll be strategic in how we do that.
And you will have a team here to do that?
Yes. English and Spanish. We had planned on 5 to 6 folks coming out to help with enrollment. So it's really just going to depend on what the team needs.
Y'all have an estimated date?
We can probably schedule, if we have the 2 days, if you have at least 4, if you can have probably 4 people here, then we can probably get it done get it done in a day.
For reference, if we do a 300 employee company, I know y'all are, it's about 200. For every 50, we usually need 1 to 2 people. We can get it done in 30 minutes for each. So we're pretty efficient. We do that. What else to note here?
At that time, you will tell them, okay, this is how much it's gonna cost you.
Oh yeah, so they have a platform that we're gonna walk through with them. That's gonna say, here's what it costs, here's what comes out of your check. Here's how it's different than what you guys had previous. Here's the summary of benefits. Like, it's gonna be in great detail. And they'll have access to go back and reference that as they go throughout the year to be able to log in and see it. We've got a platform we pay for.
The plan that we have now, Mr. Martinez, it ends when?
That's, I think,
October 1st.
October 1st. Yeah.
That's when these will go into effect.
So
No gaps in
There
coverage.
shouldn't be any lapse or anything.
No, there'll be 0 gaps. Yep. Only other thing, and this is significant, any health insurance plan, whatever you underwrite, if the census that was given, which is based off y'all's current staff enrollment, if it changes by 10%, they have the opportunity to re-rate at 10/1. So to give us an alternative rate. The base plan isn't going to change, but the curative plan could shift. I have put in a favor that they aren't going to change it. They've said that. I have not gotten it in writing. I was talking to them on my way over here, but that is something to be aware of, and I've let them know about that. Like, that it's a possibility, right? Think about it from a risk perspective. If I'm expecting 180 people and 5 people enroll, it could shift the risk. So that is something that we're going to be monitoring to make sure we can hold those rates.
in page 8 of this booklet, all the school districts, with their plan, Bristol, Carrizo, page 8, and not that he gave us.
You said page 8.
So,
Yes, those are the facilities that are in network.
but they're with your plan.
Yes.
This is not with the school district. This is based on zip code
Oh.
and city of which patient care facilities accept the curative or the trust health, correct?
I think, I'm blanking on it. I know the city of Crystal City just signed with Curative. I know that there's one in Mission that's also with Curative. They also have an option that they have what's called a cash card. It's a really cool option. I use it quite a bit. If a facility doesn't take health insurance or the health insurance, they actually have this option in Mexico. That's why it's very popular in South Texas. Curative will preload you have a cash card. I have it on me as far as a medical card, and they'll preload it to where you can pay the cash rate as well, that they'll preload. So you still pay $0, but they'll pay a cash pay for it. Curative will fund.
And that option is open to everybody?
Everybody that's enrolled in the Curative plan. Yep.
I don't know if anybody else has any questions or.
I appreciate the notation. This is pretty good.
So I mean,
Mr. President?
Yes,
No, I'm sorry. I was just going to ask a couple of questions if the board members are finished.
I think Ray was gonna
I
ask.
think Mr. Espinosa had one more question.
question, as soon as you meet with probably central office, then you'll decide when is it that you're coming with a team to sign
To
up?
enroll. It's really based off their schedule. We were going to come out Friday. We ended up moving it just because this board meeting, and we don't have to go live 10/1. So we want to make sure to be really strategic and a time that fits them. And we can do it next week, we can do it in 2 weeks.
Sooner the better. I mean,
Yeah.
I know there's a lot of questions.
I agree. So I guess also to answer that question, the worst case scenario as far as like new ID cards, getting everything integrated, we don't, once we get into that 1 to 2 weeks from the effective date, that's when it gets really tight. So we want to do it before, ideally, based off this year.
Thank you.
Dr. Reyna?
Good evening, board members. I'm sorry for the interruption here. I do have a couple of questions. I did come in a few minutes late, so I don't know if you've already shared this information. We are contributing, or say the district is contributing $225. What is the out-of-pocket premium pay for each employee for this plan, for the Trust Health? No,
For the Trust Health, it is $166.
166,
Per month.
I'm sorry. Say again?
$166.46 per month.
Per month. For the Trust Health, this is with a $2,500 deductible. This is not curative, or is it
Correct.
included? Curative
This is
and
not
critical?
curative. This is Trust
Okay.
Health to meet the ACA affordability. Yes, ma'am.
Okay, and curative is how much?
For the employee rates, let me pull that up. For the employee rate, not including the, not including the contribution, it's $988. If you net out, and then you would include the employee contribution or employer contribution to that, to net that cost out.
No, so it costs $988.
Correct, but then that does not include the $225
Well,
contribution.
so basically the employee a month is $166.46 plus 988 should they choose curative minus the 225, correct?
No, so it's either or. You pick either or plan.
It's an either or plan.
Yes,
Okay, so
yes,
it's-
ma'am.
So if I am an employee and I am just basics, tell me the difference between Trust Health and curative. What do I get with Trust Health and for $166?
Yep.
And what do I get with curative for $988?
Again, it would be, I think it's $720 just for clarification, because you would take out what the employer's contributing to that. But for the Trust Health, you get preventative care. It's unlimited. Annual physical screenings, immunizations, no cost, no deductible. You get telemedicine. That is also unlimited with MD Live. You get routine office visits, $25 copays, $50 specialists, generic drug, and this is a high level overview. You also get generic drugs are $10. Labs and imaging using their program can be at $0. So the limitations of this plan are you have annual limits for how many times you can utilize some of those options. So for primary care, you get 8 primary care visits. For specialists, you get 8 a year, 5 inpatient hospital stays, 1 outpatient surgery, 1 emergency room, 2 urgent care visits, and 1 ground ambulance trip. It does not cover tier 3 and tier 4 drugs. And then it also excludes chemotherapy, radiation therapy, dialysis, transplants, and infusion therapy. And so it is a significantly watered down plan, right? Again, 75% below what our Blue Cross renewal was. But in the curative plan, the huge benefit and why I had proposed it to the board is comparing it to Blue Cross or United Healthcare, Cigna, and all the cares that are provided. In the base plan, in comparison, to TRS, is a $4,000 deductible. So staff is going to have to pay $4,000 before the plan kicks in, out-of-pocket max of upwards of $18,000. With curative, you jump on a baseline visit, and I insure my family with this plan. You jump on a baseline visit, 20 to 45 minutes. If you do that, your deductible, copay, out-of-pocket max, co-insurance, tier 1 and tier 2 drugs, all goes to $0. Nationwide network. You do not need a referral to see a specialist. And so the total out-of-pocket cost for a staff member that's going to utilize that plan and hit those deductibles is $2,000 less, including the premium, than the TRS plan. And so wanted to make sure that we had something. I did not want to propose a really watered down plan that people sign up for and doesn't cover anything if they wanted to get a buyout plan for staff that needed care. So that's kind of the thought behind it. That's really the key differences there. It's a Cadillac style plan versus a plan that checks the box.
Well, the price differential certainly will make a difference there. Can you tell me, do you all have an agreement with hospitals in San Antonio?
Do you can they go to a hospital in San Antonio and seek care?
Yes.
Yes, ma'am.
Are they in your networks? I mean, because from what I understand, looking at the data, most of the employees of Crystal City will go to San Antonio for medical care.
Yes, they do, 100%. That's where the richest network would be in San Antonio for these two plants. We tried to make sure that we tracked within a 20-mile radius in Crystal City, Carrizo Springs, Uvalde, Asherton, La Friar, Eagle Pass, Cotulla. San Antonio, for instance, on this plan, they have 7,900 PCPs, 1,600 pediatrics. They can see 1,000 OBGYNs, 24,000 specialists, 200 hospitals, 117 urgent cares, and 71 pharmacies in San Antonio. So very rich.
You have agreements with all these entities.
Yes, well, the health insurance provider does. Yes, ma'am.
Is it a network with Methodist? Is it a network with Methodist?
Yes.
What school districts do you have in these plans?
In Curative,
In both of them, in Tress Health?
Tress Health, I do not have a school district in that plan. In the Curative plan, there's probably 20 different school districts. I know one, I think it was Mission ISD. The ones in West Texas, I'm not familiar with the names of them, but there's roughly 20 school districts that use Curative today.
Okay, I did not see that in the proposal. Okay. When did you all receive the claimant information to evaluate the plan?
August 11th. I have the date, correct date. So we received initial claimant information back in July, but it was actually incorrect. Blue Cross had given us bad claims data. And so they went back and redid it. And then we got all of the renewal and claims data August 11th when we were given the broker of record when it was processed. So we got it August 11th, turned around, got these proposals August 13th, and now we're here.
And you said that these plans are just year one. What's the anticipated increase should you stay with them in light of just the market?
I mean, the market trend for any health insurance plan today is around 9 to 15%. The reason I say this is 1 year is because I would like to, be able to look at all options, right? Look at our claims data, be able to build a sustainable health insurance plan, and not have your staff be on Tress Health forever. Curative, I believe, is a great option, right? Like I said, I'm an owner of 1921. We insure our employees with it. I think it's a great plan, but I think given the current landscape, I think it's going to be challenging to build that out with the current contribution strategy.
Granted, because I don't know what employees are going to pay $763 a month for health insurance. So the likelihood that they would go with the Trust Health, but you're saying that the Trust Health is not a very rich plan. So that's just my information. So thank you.
Any more questions? Any other questions? Peggy, do you have any questions, Peggy? No. Bruce? No?
No, no.
The recommendation, I guess, is for Tress Health with Curative, right?
Okay. Sounds good. Thank y'all so much. Appreciate it.
Thank you very much.
Guess there's no action on 5A. needed action for 5A. Take action on 5B. Do I have a motion?
I motion that, we adopt the employee group health, insurance plan as presented by 1921 Insurance Brokers effective October 1st, 2026.
Motion made by Mr. Mata, second.
Second.
Second by Mr. Houston. Any discussion? Question? All in favor? All opposed? Motion carries 5-0. Motion to adjourn?
Motion to adjourn.
Motion made by Mr. Mata, second.
Second.
Second by Mr. Houston. All in favor? All opposed? Motion carries 5-0. What time is it, miss?
6:03.